Hey everyone, it's Allie. Hope everyone is having an awesome week and enjoyed our debate on whether medical assistance in dying should be required in publicly funded hospitals or hospices. Medical assistance in dying is definitely one of the most topical debates in medicine these days. My stance on medical assistance in dying is that it should not be required in publicly funded hospitals or hospices because there is limited training in potential adverse events that could occur. Additionally, there are several logistical concerns, and unfortunately, medical assistance in dying is delivered to a vulnerable population who may not be able to rightfully consent or understand Maid. Maid should be replaced with effective palliative care practices to ensure optimal quality of care at end of life, as well as physicians' moral integrity that becomes limited, which has been explored by physicians' negative experiences administering medical assistance in dying to patients. What we do know is the criteria that has been identified in the different provinces to administer Maid, which varies widely around the world. What we can continue to educate ourselves on is the discrepancies with access to medical assistance in dying, as well as come up with a solution to decreasing physician integrity and morality caused by the administration of Maid. Focusing on improving palliative care has been proven to be an effective approach at minimizing the utilizations of Maid in hospitals and hospices worldwide, where Maid is legalized. My opponent, Lori, argued that unnecessary transfers to hospitals can be difficult or inhumane for patients. While I agree that transfers may be difficult for some, they are common practice in medicine and often can be made more comfortable by providing medications as well as blankets and pillows to make the ride as comfortable as possible. Lori also argues that not administering medical assistance in dying can cause prolonged emotional suffering. However, palliative care often allows for patients and their families to begin the grieving process and allow for the patient and their families to emotionally come to terms with this terminal illness of their loved one. Prematurely administering medical assistance in dying may not allow for this necessary process. Lori also argues that objection to medical assistance in dying negatively impacts patients' dignity by communicating moral judgment and disapproval. However, communicating moral judgment and disapproval can also be provided by providing the message that lives of the ill and disabled people is not worth living, which is definitely not the case. My question to all of you is, to improve equality to the entire population, should debilitating and chronic mental illness be added to meet the criteria of Maid?